Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today we're going to learn about heart attacks, both treatment and prevention. Joining me to help us better understand this topic is Interventional Cardiologist Dr. Bashar Samman. Dr. Samman, thank you for joining us today.
Thank you for having me, Michelle.
Now, for our audience, let's start with the basics. What is a heart attack?
Well, a heart attack is when an area of the heart doesn't get blood. Just to start again, the heart is a muscle. And for the muscle to function, it needs blood to come to it. And the blood with the heart, and if we look at this picture over here, we'll see that the heart has three arteries. One that goes to the front, what we call the LAD, one to the bottom, the right coronary artery, and then the next picture, the third one, is the left circumflex. So if one reason or another, blood get interrupted, the blood flow get interrupted to one segment, what's going to happen is one segment, if this is the artery open, and if we have a blood clot forming in it, like in this picture, we're going to see that not enough blood is coming down. So in that area of the artery, that area of the heart is going to be damaged, and it's going to die. The most common reason is a blockage in the artery. That's the most common reason, a blood clot form in the artery and close it. We have other reasons for it. Sometimes very severe spasm in the artery can cause it. But commonly, as I said earlier, a blood clot is the most common thing that happens.
Now, how common are heart attacks?
Heart attacks, or if we want to, what we call cardiovascular disease, cardiac disease, is the leading cause of death. Is definitely the leading cause in men, but a lot of us think of breast cancer as the leading cause of death in women, which is not true. Not to say that breast cancer is not important, but still in women, the leading cause of death is heart disease and heart attack, and the consequences of heart attacks are, the leading cause. The only difference between men and women is that men get affected by cardiac heart attack, or what we call myocardial infarction, about 10 years earlier, and that's related to the hormonal protection that women have. But there still is the most common cause of death across the country. So not only is it important for men, but men and women equally.
So heart attack is the most common cause of death for men and women across the nation right now.
Cardiac disease, when we say cardiac disease, is heart attack and the consequence of heart attack, heart failure, arrhythmia, irregular heartbeat, they all come into a big group that we call cardiac disease. But it is the leading cause of death.
Now, who is most at risk for developing cardiovascular disease?
The cardiovascular disease is almost the same reasons or same causes for all diseases that are cardiovascular. We're talking about high blood pressure, diabetes, high cholesterol, family history of early heart disease, and that's really one of the things that it's important to us. Some of us may have a family member that had a heart attack in their 80s. That does not add to our risk. What adds to our risk, somebody in our family that had a heart attack in young age, in their 40s and 50s. And last but not least, smoking. Some of the things we can control. Unfortunately, we can't change our family history. We're born in that family, that's ours. But we definitely can do a lot about smoking. We can do a lot about controlling our blood pressure, and we can do a lot about controlling our cholesterol.
Aside from not smoking, what else can people do to lower their risk for developing cardiac disease?
Important thing is to do, if you want to say the right thing. Eat right, stay away from high salt, high fatty food, exercise. The value of exercise, we knew the value of exercise a long time ago. But there's more and more data coming up to show us the tremendous effect of exercise on lowering our risk of heart attack, dying from heart attack, reducing our risk of high cholesterol, diabetes, high blood pressure. So the effect of it is not one thing, it's multiple things. Exercise is important if we don't have heart disease, and it's very important if we already had a heart disease. So even if we had a heart attack, that doesn't mean we should not exercise. We should, definitely under the direction of our physician. Those are the very important things that we need to do, in addition to taking the medication that are prescribed to us if we have high blood pressure, if we have high cholesterol, controlling our diabetes. They all reduces our risk. Unfortunately, none of us have a zero risk of having a heart attack. All what we can do is to try to bring that risk as low as we can.
Dr. Samman, this is great information. We need to take a break. We'll continue in a moment.
Thank you.